People from all over the world are exposed to traumatic events. Trauma is so common that over 70% of people will be exposed to traumatic events in their lifetime.
Exposure to war, violence, disasters, sudden loss, serious illness and other overwhelming or disturbing events are traumatic experiences.
It's common for people exposed to traumatic events to experience symptoms including re-experiencing the event, feeling on edge, and avoiding the memory or triggers of the event.
For most people, these symptoms resolve within a few months without the need for help. However, for some people, these symptoms persist or worsen and are accompanied by changes in thoughts and mood.
When these symptoms continue and significantly impact their daily life, we call this post-traumatic stress disorder, or PTSD.
Rates of lifetime PTSD around the globe have been estimated to be between 0.3% and 9.2%, with variation between countries and trauma type. Interpreting the variance in rates reported around the world is complex, but may be due to cultural differences influencing responses to diagnostic instruments, stigma towards mental illness, as well as variation in exposure to traumatic events such as war, crime, or natural disasters.
It's not surprising that veterans are twice as likely to experience PTSD as the general population, given the increased likelihood of experiencing traumatic events such as combat and experiencing prolonged conditions of life threat during military service.
In terms of recovery, people who experience war-related PTSD have a much slower rate of recovery than other types of traumas.
Veterans, in particularly young veterans aged 18 to 27, are twice as likely to die by suicide as the general community, suggesting we need to do more to provide treatment for this population to minimise secondary risks such as depression, suicide and substance abuse.
Early stages of mental ill health are not easily confined to one diagnosis and often have symptoms that cross between different disorder categories.
We know that mental ill health develops in stages, and helping people at the earliest possible stage leads to the best outcome. Effective treatment for trauma-related mental distress and PTSD may include medication as well as talking therapies.
For service personnel, and indeed anyone who has been exposed to trauma, the potential need for mental health support must be identified and provided at the earliest possible stage to provide the greatest benefit.
If you've experienced trauma and you have been experiencing any of these symptoms, it's okay to seek help. There are services that can help you.